Hey guys, Larissa here with your labor nurse. Excited to be bringing you some new content today. Today I'm going to be talking through rooming in. It might be something you haven't heard about. It's not every hospital is currently doing rooming in, but I wanted to explain for those of you that might have some confusion about where it started and why we're doing it and why some hospitals aren't. So rooming in is basically the child or the baby stays in the room with you at all times after birth. The only reason that they would leave the room under this rooming in ideas for a medical procedure. So maybe if you have a little boy and they go to have a circumcision, that would be a reason that the baby would leave the room. So particularly in the evening when you're sleeping, maybe napping, whatever you want to call it, the baby would remain in the room with you. This is different than previously. Most hospitals just had like a well baby nursery. So all the babies would go to a nursery in the evening and then the parents would sleep and babies would come out for feeding. So if you go to a hospital to give birth that has a rooming in policy, the baby stays in the room with you in the evening. So what's rooming in? Why did this become popular? Where is it coming from? So the World Health Organization put out a baby-friendly hospital initiative in order to promote and support exclusive breastfeeding. So if you ever hear of a hospital being deemed baby-friendly, which has to do with this initiative, they have to follow these specific steps in order to be deemed baby-friendly. And that means that they are basically jumping on the bandwagon of that exclusive breastfeeding. Just because a hospital isn't named baby-friendly or doesn't meet all these qualifications doesn't mean that they don't do some of these. So if a hospital is deemed baby-friendly and they're part of the baby-friendly hospital initiative, they will have to complete all of these, basically the things that I'm going to go through, they have to meet all of these requirements. Other hospitals may choose to do some of these requirements and not others. They may be working on slowly transitioning their hospital to the baby-friendly initiative. Again, it depends on what your hospital is doing. So I'm going to go through these steps and kind of what the hospital is doing, and this is where the rooming in comes from. So studies have shown that rooming in supports breastfeeding and it increases the number of infants that remain breastfeeding for longer. And so that's the reason that rooming in has been pushed so much. So here's like the list of things that they go through. So if you notice that your hospital is starting to do some of these things, they might be kind of leaning towards the baby-friendly hospital initiative if they're not already deemed a baby-friendly hospital. So they have a breastfeeding policy that all staff has to know about and be educated on. All health care staff, including like the nursing techs or CNAs, whatever the hospital unit calls them, have to be trained on these things as well, and they have to implement this policy. The nurses are required to inform all of the women about breastfeeding. So when a woman is admitted and say, usually it's asked, do you want to bottle feed or breastfeed? They have to make sure that even if the woman is choosing to bottle feed, they have to educate on why breastfeeding is encouraged. They have to help mothers initiate breastfeeding within a half an hour after birth. Again, there are tons of stipulations on how soon baby needs to get on the breast and skin to skin and stuff like that. But their rule here is that the nurses need to help with initiating that breastfeeding within the first half hour of life. They have to be able to show women how to breastfeed and how to maintain lactation, even if they're separated from their infants. So say baby has to be transported or go to like the nursery, the level 2 nursery, if they're a little bit more critical and unable to stay in the room. That would include starting a woman pumping and things like that to help with the breast milk supply. Give newborn infants no food or drink other than breast milk unless medically indicated. So that would be a pediatrician prescribing donor milk or formula, whatever that hospital has. And then here's the next one that we've been talking about that this whole video is about is practice rooming in. So that means mothers and infants are together 24/7, and that allows the baby to, then you're breastfeeding on demand. So it's not this every 3 hours, which is what we want, at least every 3 hours, but it's just on demand. So especially when that cluster feeding kind of comes in, the baby wants to eat, every hour to 2 hours, the rooming in allows for that and allows the mom to begin to kind of get those cues from the baby because every baby's different. So different cues will kind of indicate mom. They'll tell you when you go to breastfeed, it is so much easier to catch the baby before they're screaming, because when they're screaming at the breast, they're irritated and the mom is stressed. So rooming in kind of allows the mom to listen for like the sucking and the rooting and looking for those things. So that's kind of the big push on the rooming in. The last few things is encourage breastfeeding on demand, which I kind of just talked about. And then they want us to have they want the hospitals to have breastfeeding support groups and refer moms to them. So whether that's like a lactation consultant in the hospital or a group that meets weekly or biweekly that helps moms through breastfeeding, especially as they're discharged, because we can help in the hospital with the breastfeeding if that's something that the mom wants. Once you go home, it can get a lot more frustrating because you don't have that nursing staff to help you. So I hope that kind of clears up about where rooming in came from and why hospitals are kind of pushing that and why your hospital may or may not do that. Again, you're the patient, so if you want your baby to stay in the room and your hospital doesn't do that, you can always ask. There's no problem with that. If your hospital doesn't do rooming in and you would rather have your baby sent to the nursery in the night, I mean, totally your choice. So just to kind of understand why it's encouraged by the World Health Organization and specifically why it's linked to that breastfeeding. Awesome. Please put comments and things like that below. Again, I'm not a doctor, so I don't prescribe. I'm just here to educate you so that you feel informed on why hospitals are doing certain things, and so that you can feel informed as a mom to make the best decisions for you and your babe.